Okay, we're going to begin a series of lectures of cardiac pathophysiology, starting with hypertension. And we'll talk about how hypertension, if uncontrolled, progressively worsens and perhaps leads to ischemic heart disease and perhaps even heart failure, for example, congestive heart failure. So we'll start off with hypertension. And hypertension puts the patient at risk of many different factors that affects nearly every organ system of the body. For example, the central nervous system. A patient may suffer a hemorrhagic stroke, which may lead with a neurological or cognitive impairment. There may be an aortic dissection that takes place that may expand and create a false lumen. It promotes and accelerates the development of atherosclerosis, which we'll talk about later. And this will eventually lead to ischemic heart disease, and perhaps the patient may suffer from a myocardial infarction or heart attack that may scar the heart tissue and eventually lead to either a systolic or diastolic function of the heart, leading to congestive heart failure. And we'll talk about how the ischemic heart disease makes the heart more vulnerable to cardiac dysrhythmias. And we'll talk about the systemic SVTs, the supraventricular tachycardias, or the ventricular tachycardias or dysrhythmias, and how to go about treating these. Also, the hypertension, when it progressively worsens and leads to ischemic heart disease, it also many times is associated with vascular disease and may also lead to renal failure. So all of these factors we'll talk about in greater detail in the following lectures. I'm going to start off with hypertension. Hypertension, by definition, is an increase in mean arterial pressure or an increase in systolic and diastolic pressure. For example, systolic greater than 140 and diastolic greater than 190. And we can see that the mean arterial pressure, an increase in mean arterial pressure, as we said, is hypertension. And the components of mean arterial pressure are the cardiac output and the systemic vascular resistance. These multiplied to each other will give you the mean arterial pressure. So many times with essential hypertension, a patient has an increase in systemic vascular resistance. That the vasculature has an increase in resistance either through an increase in vasomotor tone that's leading to vasoconstriction in all the vessels systemically, and collectively that increases the vascular resistance, also known as the systemic vascular resistance, or there can be a decrease in the luminal size through the process of atherosclerosis, in which there's a plaque that builds up in the luminal area of the vessels, and therefore that eventually decreases the luminal size, and therefore there's an increase in resistance that the heart has to pump against. So that's also an increase in systemic vascular resistance. So these are some of the causes of increased blood pressure or hypertension. There's many other causes that we can talk about later. For example, endocrine problems such as hyperaldosteronism or Cushing's, where there's an increase in cortisol, which is secreted through the adrenal gland. But right now we're going to focus primarily on essential hypertension, which is primarily an increase in systemic vascular resistance. And we said, for example, an increase in vasomotor tone or an increase in the atherosclerosis process, which decreases the luminal size of the vessels, and therefore we've said there's an increase in systemic vascular resistance. So when that happens, what ends up happening is that there's an increased pressure within the left ventricle. The left ventricle, when it contracts, it has to contract against a higher resistance, as we said here, in order to promote a forward flow. And when there's an increase in systemic vascular resistance, that puts the left ventricular wall at a higher tension, a wall tension as we say, that the myofibrils within this left ventricular wall has more tension there, which we said is a wall tension using Laplace's law, that as this pressure increases, the left ventricular pressure, it's going to increase your wall tension. And the detriment of that part is that it increases your oxygen demand. Okay, and we're always worried about the O2 supply and O2 demand relationship. And in a previous lecture, we talked about oxygen demand. Okay, the oxygen demand, for example, in the coronary circulation is that it's increased. The O2 demand, meaning the heart requires greater oxygen delivery and consumption when there's an increase in wall tension, increase in heart rate. For example, a heart rate greater than 115 starts to decrease your cardiac output, and an increase in contractility. All of these factors are going to increase your O2 demand, your myocardial oxygen demand. And if that demand exceeds your supply, the patient or the heart will start to suffer from ischemic heart disease or myocardial ischemia. So we're going to go back to this and talk about how does the heart compensate for this increased oxygen demand due to an increase in wall tension. So the heart compensates through a process of left ventricular hypertrophy. Okay? A concentric left ventricular hypertrophy due to a pressure overload. And if it was a volume overload, this would have been eccentric left ventricular hypertrophy. But because this is a high pressure, it creates a concentric left ventricular hypertrophy. And if you look at Laplace's law, we can see that H being the thickness of the left ventricle, that increases with left ventricular hypertrophy. For example, in this figure here, we can see that this is an example of left ventricular hypertrophy, and the H value, or the thickness of the left ventricle, is increased. And the significance of that is that this happens to be the denominator value in Laplace's law. Laplace's law generally depicts a spherical area and can tell us how much tension takes place within a sphere. And we're going to apply that law to the left ventricle. Although it's not a sphere, we're going to try to treat it as a sphere and see how does that affect the wall tension. And as we see the H value, as left ventricular hypertrophy takes place, the H value increases and therefore increases the denominator value and therefore will decrease your oxygen demand. So this is the initial compensatory response of high blood pressure. We're going to see what happens as the heart continues to increase the thickness of the left ventricle, and we're going to see how the left ventricular hypertrophy will eventually lead to a diastolic dysfunction, and we'll see how does that affect the physiology or the pathophysiology of uncontrolled hypertension. And we'll see that the diastolic dysfunction will ultimately lead to a bulky, non-compliant left ventricle. And we'll see how does that affect the Frank-Starling curve and the cardiac output. And in the next lecture, we'll talk about what happens when the oxygen supply, or the O2 demand and the O2 supply, the relationship becomes imbalanced and leads to myocardial ischemia. And if that myocardial ischemia is not taken care of appropriately, it may lead to ischemic heart disease, for example, myocardial infarction. So we'll talk about all this in greater detail in the following lectures, and we'll follow the trend of hypertension, or rather uncontrolled hypertension, leading to ischemic heart disease, and eventually perhaps even myocardial infarction, and then what takes place with a scarred myocardium that leads to heart failure.